2020, a novel pneumonia disease originating in Wuhan was confirmed by World Health Organization (WHO) on the 12th January before becoming an outbreak in all countries. Malaysia reported its first COVID-19 positive case on 3rd February 2020. The case involved one man from China and one is Malaysian which just came back from Singapore. Starting from that, Malaysia faced first wave of COVID-19. Most cases reported in the first wave were imported cases from China and their contacts. The first wave was successfully handled by February 27, 2020 with all 22 previously reported cases. On March 2020, a sudden increase in the number of positive cases was reported. This new cluster marked a bigger threat of COVID-19 in Malaysia. The number of critical cases increased each day. To keeping the spread and mortality under control, a Movement Control Order (MCO 1.0) was implemented on March 18, 2020. The government has imposed a 14 days MCO from 18 March to 31st March nationwide to curb the spread in Malaysia. People are restricted on movements and total shutdown of almost all sectors apart from essential economic and service sectors. Malaysia is experiencing a spike in cases since the third wave of infections began to sweep across the country in September 2020, threatening to overwhelm the public hospitals. To break the COVID-19 chain, the government, with the advice of the Health Ministry, has decided to implement the Movement Control Order MCO 2.0 for a period of 14 days, starting from 13 January 2021 until 4th February 2021. Under MCO 2.0, movement would be limited to a 10-kilometer radius from a person's homes and only 2 from a household are permitted to leave the house and travel in the same vehicle at any one time for purpose of buying necessities from supermarkets or grocery shops. However, Malaysia government has managed to limit the number of deaths due to COVID-19 during MCO 2.0. After a while, Malaysia experienced total lockdown with MCO 3.0 for 2 weeks starting from 1 June until 14 June 2021. This total lockdown need to be done as the cases rises each day with 70,000 active cases. This will be similar to the first MCO announced in March 2020 with strict restrictions on movement and the total shutdown of almost all sectors apart from essential economic and service sectors.
When COVID-19 spread rapidly across Malaysia, the economy was immediately hit by one of the worst crises in modern history. As movement restrictions tightened in 2020, economic activity slowed down drastically, causing GDP to fall sharply by 5.6%, Malaysia's worst performance since the 1998 financial crisis. Unemployment also rose significantly, reaching 4.5% in 2020, leaving many people suddenly without stable income. Thousands of workers were abruptly laid off as companies struggled to survive, especially in sectors that were heavily dependent on physical operation. The tourism industry was one of the hardest hit. When borders closed completely, hotel, travel agency and airline lost almost all their customers. Malaysian tourism revenue dropped dramatically as international arrivals fell to historic lows. Popular destinations such as Langkawi, Melaka and Kota Kinabalu became unexpectedly empty, affecting workers who rely on tourism for their daily income. Retail business also suffered. With many shops forced to shut down temporarily or even permanently, shopping malls that were usually crowded become almost silent as people stay at home and spend money more continuously. Small and medium enterprise, which is SME, were affected deeply as well. Many struggle to pay rent, salary and operational costs. Without customer walking in, SME had to quickly adopt online platform, but not all of them could adjust successfully. Beyond financial pressure, many families face growing mental issues. Reduced income mean that households had to budget strictly, prioritizing essential needs. Many Malaysians experience anxiety and uncertainty as the crisis continues unpredictably. Overall, the COVID-19 pandemic created a nationwide economic shock that affected almost every sector. Its impact was felt widely, intensively and immediately, setting the stage for government intervention in the months that followed.
To shield citizens from the crisis, the Malaysian government launched a series of economic support packages worth hundreds of billions of ringgit. First came Prihatin. It was immediate relief. For the first time, millions of households received direct cash assistance through Bantuan Prihatin Nasional, known as BPN. But cash alone wasn't enough. To stop mass layoffs, the government introduced the wage subsidy program by co-paying salaries of up to 1,200 ringgit per worker. The state effectively became a partner to private companies, saving nearly 3 million jobs overnight. Then came Penjana, Permai and Pemerkasa. Each package had a specific mission. Penjana focused on restarting the economy with tax exemptions for buying cars and homes. Permai and Pemerkasa fought the prolonged lockdowns, pouring billions into healthcare, digitalization for SMEs, and social welfare for the vulnerable. Meanwhile, Bank Negara Malaysia stepped in. They slashed interest rates to a historic low of 1.75% and introduced a blanket loan moratorium. For 6 months, individuals and businesses didn't have to pay a single cent to the banks. These measures provided critical relief. They kept families afloat and gave businesses a fighting chance. These lifelines preventing mass unemployment and helped the economy to survive its darkest hours.
Minister of Malaysia Ismail Sabri has finally announced that the borders will be fully open from the 1st of April as the country begins its transition into the endemic phase. Now, this marks the final step in lifting restrictions, especially as more than half of the adult population had already received their booster dose.
The true turning point from crisis to confidence was the national COVID-19 immunization program. By early 2022, Malaysia achieved one of the highest adult vaccination rates globally, a public health success that gave us the crucial permission to move forward. This success led directly to the transition to the endemic phase and the full reopening of international borders on April 1, 2022. The economy did not just recover, it rebounded powerfully. Supported by a robust demand and policy, Malaysia achieved a phenomenal 8.9% GDP growth in 2022, which is a performance not seen in decades. This dramatic comeback signaled that the economy was not only back but stronger. Crucially, the labour market fully healed, with the unemployment rate steadily dropping back to the pre-pandemic levels, signaling stability for millions of households. Crucially, the recovery was defined by adaptation. The MCO accelerated
the digital transformation of Malaysian enterprises. Millions of SMEs were forced online, adopting e-commerce, digital payments, and delivery services. This permanent shift made our economy more resilient and technologically advanced. Furthermore, the hardest hit sector, tourism, staged a significant revival, with arrivals in 2023 reaching nearly 70% of 2019 figures, injecting vital revenue back into the hospitality industry.
Kita percaya dengan pembukaan sempadan negara ini bukan saja memberikan kebebasan kepada rakyat kita untuk keluar negara dan juga rakyat negara lain datang ke Malaysia. Kita percaya ini akan meningkatkan ekonomi kita, dan kita percaya industri pelancongan yang begitu terkesan akibat daripada penutupan sempadan ini boleh dibuka sepenuhnya.
Last but not least, the pandemic served as the ultimate stress test for the Malaysian economy. The analysis shows a journey defined by shock, shielding, and powerful recovery. The key lesson is not just that Malaysia bounced back, but how it bounced back, rooted in the agility of government policy and the resilience of Malaysian businesses to pivot rapidly. Moving forward, the focus must be on maintaining this momentum by strengthening social safety nets and investing further in the digital economy.